Welcome to Inflammationnation. My name is Brian Lynch. Inflammationnation is a podcast from Arthritis Ireland aimed at increasing awareness and understanding of arthritis and related conditions. I'm delighted to be joined by Dr. Yvonne Codd, who is an occupational therapist interested in the impact of rheumatology conditions on occupational identity and adaptation. Yvonne is also currently working part-time as a researcher in Trinity College Dublin. Yvonne, you're very welcome.
Thank you very much for the invitation.
Great to have you here. I wonder, can we start perhaps by kind of setting out something of the scale of the challenge? So you're here to talk to us about work and arthritis. And I guess maybe for many people, they will think of arthritis perhaps as a condition of older people. So therefore maybe something that relates to people in their retirement. But we know that for inflammatory arthritis, it's very different. So how many people do we know maybe have to change jobs or retire from their career, retire early as a result of their arthritis condition?
Okay, so Brian, we know that arthritis has a huge impact on a person's workability in a day-to-day level and also on their sustained working over their lifetime. The majority of people with inflammatory arthritis are diagnosed between the ages of 35 and 45 years. So that's working lifetime for most people. In terms of Ireland, stats that we know, 7 million days of work absences occur each year due to musculoskeletal disorders and arthritis. And there's a huge cost with that as well, with €750 million in illness payments each year as a result. When we look at permanent job loss, the picture is even more grim, unfortunately. Stats by Stephen Bevan in 2009 tell us that 40% of Irish people with rheumatoid arthritis leave the workforce in their first 5 years of diagnosis. And there was a huge European study done some years back, a 32-country study that told us that 1 in 3 people with inflammatory arthritis leave the workforce in 2 years. So myself, I did research quite recently. It's under review, but the findings from that was in the first 2 years, 50% of people with inflammatory arthritis are leaving the workforce. So it's a huge problem. And it's probably a problem that is not as understood in day-to-day terms. And there's an awful lot that I suppose we need to do in terms of trying to improve that, because we know if people end up falling out of work and are unable to sustain workability and move on to disability payments, only 2% of people who go on to disability payments return to work. So that's why we are very keen to have early access to services and early intervention to actually keep people in work.
I wonder, Yvonne, then, listening to those figures, they're quite startling, aren't they? But yet at the same time, there is almost a sense that these challenges are perhaps less well known and understood. And I wonder if that in itself poses difficulties around resolving them and helping people to stay in work for longer despite their arthritis.
I think that's really true, Brian, and there are a few reasons for that. One of them being the fact that there have been so many huge advances from a drug therapy management point of view, which is fantastic. The advances with the biologic therapies have decreased joint destruction. They have changed the disease process for many people and helped people achieve remission. But unfortunately, that hasn't had the same consequential translation into improving workability over time. So we know that work needs to be explicitly addressed as part of management if we are to help people stay in work. And I think that's something that we know and we want to do well on, and we need to continue to do better on. I was involved in a paper in 2018 where we looked at rheumatology medical teams' perspectives of employment with arthritis. And what we found is what we hoped to find, in that very much consultants, physiotherapists, nurses working in rheumatology see employment as part of the scope of health management, and they do see occupational therapists as the profession who address that need. But where the results were less positive were that actually asking about work was falling down, I suppose. The members of the team really said that things like limited time and pressure in medical clinics, limited access to resources, all translated into an unmet need where predominantly they were relying on clients to raise work issues. So they're relying on clients going into medical appointments to name, I have a worry about work.
Yes.
I'm concerned about work. And that's a really big problem. And I suppose if you are trying to access services, you need to, and so education wise, I've done a lot of work trying to educate my colleagues within the services to say you need to ask about work at every appointment. You need to explicitly ask the client, how is work going now? Not just the first time they ever present, but at each consecutive appointment, how is work now? So that there is that mechanism to capture a concern or a vulnerability and to channel that person to services to have that need addressed. I guess this podcast is an opportunity for me to stand on the other side and say to any person who has any form of arthritis or musculoskeletal difficulty, if you're working and you want to stay working, I would really encourage you to name that work concern when you do attend for your medical appointments. Name that's something that you are looking for support with, and ask for that onward referral to OT so that is addressed and supported. I think that's going to have a huge impact by raising the awareness on both sides that employment is impacted by arthritis, and employment can be improved in a day-to-day, but also retention over time if the addressment mechanisms are there and if people access the services that they need.
That is a really important point to make, isn't it? And it's part, I suppose, of our own work as a patient organisation, educating people living with arthritis around kind of appropriate ways to raise those issues, to know that they can and that they should raise them. And hopefully then, it's kind of educating for both sides, isn't it?
And I think we have a long way to go. And the OTs in Ireland did a study, and they looked at every person who attended their service in 2018 who was of working age over a 6-month period to see what their work status was. And there were 600 people included in that piece of work. And within the 600, 65% had work difficulties, and they were medium to high risk. 65% is a huge amount of people. 20% weren't working because of their condition, but they actually wanted to work and they wanted to go back to work and they didn't know how. And yet within all of that, only 15% were actually referred for work management. So the need was so much greater than the purpose of the referral. So I think there's definitely scope for improvement on all sides so that we can deliver the service that we're fit to deliver and that's meaningful for people. And I think that's something that's really important just to be thinking about.
Absolutely. I wonder if we could look at maybe a couple of practical issues in terms of, so okay, we've been talking there with regard to, having these conversations with your healthcare team.
Mm-hmm.
But let's look at the work environment itself. So someone is newly diagnosed or in fact has been living with a form of arthritis for a while, but not told colleagues or not told their employer. What's their responsibilities around that, and what kind of advice would you offer someone in terms of an appropriate or a safe way to do that for them?
Okay. Disclosure is a huge issue, and disclosure is a very personal and very sensitive issue for an awful lot of people because there's so much fear and anxiety, and there's also very often a lot of preconceived negative consequences about disclosing. People often tell me they're afraid they'll be gotten rid of if they name that they have an arthritis, and I think the burden that comes with that causes huge stress, and we know that stress is not good for arthritis of any type. And yet I know on a practical level from clinical in my practice and also from research that if you do disclose, you actually manage an awful lot of those psychological stresses and worries much better. You're brought under an umbrella of protection in terms of employment legislation. So it means that you therefore are able to access certain services. You're able to look at reasonable accommodations, which is something I know you're familiar with, Brian, which are named under the legislation, where you can make changes to your work environment if that's what the issue is, to your routines and patterns around work, or managing some of your shifts and responsibilities. So there's a lot that can be done, but concern around disclosure is something that's very real. But I would encourage people that we know outcomes are better if that's the case. So if it's something you're thinking about, I would access the services that address this. So I would definitely encourage you to ask to talk to the occupational therapist. I would put time into thinking about what your concerns are around your work, because sometimes it's a physical issue that people need support with, making changes to their physical workspace. Sometimes it's an awful lot of the time the psychosocial impacts in managing expectations of yourself to do the best job you can all of the time, what you think other people expect of you. That's also a huge thing. So that disclosure piece and naming the issue can relieve an awful lot of that burden, but it needs to be done with support. And I would encourage people to access support as they prepare for that.
You mentioned there reasonable accommodation, and it's obviously, it crops up a lot. What is meant by it, and how can it benefit people?
Okay, so reasonable accommodations are set out in the legislation, and what they are changes to the tasks and the structure of a job or workplace that will allow a person who's qualified to do the job to be able to continue to do their job whilst managing a condition. So I suppose that's quite broad, but there are a number of things within that can be looked at, and it comes back down to, I suppose, where the person is at in their journey. So I suppose within OT, if I was working with somebody who is working and has a work issue, I would be looking at them first and foremost, the person. What are their issues physically in terms of joint symptoms, pain, early morning stiffness? What are their own, where are they at from a psychosocial perspective in terms of stress and anxiety and how they're managing those things? I'd also then be looking at the person in work. So what's their work environment? What's the physical demands that they're required to do in their job? What are those psychosocial stresses in their work environment? What is the work pattern and routine that's there? And then the third part that I would be looking at is the person outside of work. And the kind of steps that they do in their day that help them maintain their work. So like their commute, how far their commute is, how they get there, what their conscious self-care is like. So if they're eating well, what their sleep is like, and how they're managing exercise and the things that we know will help keep them in work. Within all of that, you'll come up with a plan of intervention that can help the person where they're at right now to manage their work, but also how you can build capacity to help them manage work better. So sometimes reasonable accommodations come in here where recommendations might be around making physical changes to the workstation, maybe setting up a work environment that suits their posture better, that means they're not overstretching or reaching or working in brace hold positions. Sometimes it's making changes to their routines and their schedules within the work environment. So it depends on the job that you have. Some people have a lot more flexibility and autonomy in their job. Sometimes we might access reasonable accommodations to say that we recommend that this person has regular break times or shortened shifts or maybe no night shifts, or kind of looking at the pattern of their work routine that they need. So that would fit under a reasonable accommodation as well.
Do particular challenges arise if the nature of the job itself and a person's capacity to be able to undertake that has changed dramatically because of their diagnosis or how their illness is now? So this might be maybe a case of more, say, manufacturing or physical work, where because of, lots of different things that have been going on in someone's body, they can't do the job, that particular job anymore. What challenges arise there? What recourse has an individual got?
It's difficult. If you physically can no longer continue to do the job, under reasonable accommodations, it's to do the job you're qualified for, and you must be fit for work on a level. There's often wriggle room to change elements of jobs. Sometimes people are redeployed to different sections within the same company so that they can continue their work. And sometimes there is an element of retraining that's required as well. So it's trying to see, for that person, where they're physically at, is this likely to be a temporary or a longer term thing? Because flare is really going to have a big impact on how a person can work in a moment. But when flares settle, making longer term adjustments to work can change that. So it depends really. It is, and that's why it's difficult in a way to give generic advice, because each person is different. What they want out of work is different. What their financial commitments or family commitments dictate their work means to them. All of those things have wider impacts on decisions that people will make. But I suppose the one thing we do know is that often people make reactive decisions around work under stress or in a moment to reduce hours, to change role, to leave work because of the pressure and burden and stress. And I suppose I would be really encouraging people to think about work just as they think about their health or their drug therapy decisions, to plan actively for work, to think about what am I doing, how am I doing it, how could I do it differently? Because if you can make those changes proactively, where you're leading, not driving, you're much more likely to make good decisions and seek support with services when you're trying to navigate some of that. Because as I said, for people who leave work, it's so much more difficult to get back to work because it gets complicated with payments and different things and loss of confidence. So trying to keep people in work is where we're always at.
Yeah, I mean, what I'm hearing there really is the importance, like you were saying earlier, about having conversations, leaning into people, we'll say, asking for help, looking for advice, talking to family, talking to your healthcare team. So then whatever decisions you make, at least they're informed, they're considered, rather than kind of, something that's more reactive and all the challenges that arise from that.
And often people don't know what's out there. So they're making decisions in the world that they're in at that moment. And if you can, as you say, lean in, seek support, ask questions, ask within your healthcare team to see OT. Citizens Information have fantastic supports available too in terms of guidance around structures that can be there, that can be accessed. Gov.ie cover an awful lot of the Department of Social Protection benefits and support. So widening your pool of knowledge gives you a bit of breathing space to make decisions that you feel in control of, rather than things stacking up and landing in on top of you. So that's really important.
You mentioned there earlier about the variability of symptoms, and the wide range of individual cases. And equally, and from the employer perspective, there's a large variety of different types of organisations. We obviously have a lot of multinationals in this country. Equally, there are a huge amount of SMEs. We have people who are self-employed. The gig economy is growing in Ireland. So are there different kind of practices that pertain across all of those? Like presumably what the resources that might exist in a multinational, where you have HR departments and large variety of supports there, as opposed to a much smaller company. Does that in itself raise challenges for people?
It absolutely does. There are differences even in terms of benefits and supports between the public sector and the private sector. So if you work in the public sector and you require any changes to your work environment, there are mechanisms in place there quite easily that those changes can be made, and you would negotiate through your line manager with support from services as you need them. If you're working in the private industry, it's different. So depending on how big the company is, they may have capacity to address those needs quite easily, and they can fund changes of equipment or facilitate changes of work hours. Smaller companies, it's more challenging. But again, there are supports there. So the Department of Social Protection have a number of different grants available for the private sector. There's a workplace equipment adaptation grant. There's employee retention grants. There are wage subsidy schemes that all apply specifically to the private sector. So they are important to know about. They're important to read up about, to understand a little bit more, and then to help navigate some of those pieces, because often it's not that a company, well, in my experience, I've had very good experience of working with a wide range of companies on behalf of clients, and it's more about education, reminding about legislation and entitlements, and then encouraging that negotiation piece so that you can translate that into best outcomes for people, and letting people know here are the supports that are here to make that change, that it's not all one person's job.
Of course, yeah. We're kind of at a really interesting period in terms of, let's call it the future of work, because the pandemic has changed how people are working for so many of us. And I'm wondering, is there kind of much information coming through yet with regard to kind of the dynamic of working from home? So many people working from home, and this idea of blended work, how that's affecting things at the moment. And I suppose, again, particularly for people with arthritis, are there issues that are emerging there, or positives in terms of no longer perhaps long commutes, greater balance in the working day? What are we hearing so far?
Yeah, I think COVID has changed work for all of us, hasn't it? It's really changed how we think about work and how our relationship with work is. It's depending on the type of role that people are working in. And again, everybody is individual. But for those who are working from home, there have been some and have more office-based kind of jobs, that idea of working at the kitchen table and then trying to tailor that actively. Again, this is now your work environment, so it needs to be set up properly to suit you in terms of screen height and chair and mouse use and all of those very physical things. I think people working from home have also really had to think a lot about their routines and patterns. And I mean that in two ways. And one that's common across the board for everybody is that resisting the always on approach.
Of course.
I've got to be busy. I've got to be always available. There's a nice cleanness that goes with going to work, working and leaving work. Whereas when your work is your home, it blurs. So managing that has taken some time for people because they're so happy to be facilitated to work at home that sometimes there can be an overgive that's difficult to sustain over time. The other thing that's been quite difficult for a lot of people and has taken a lot of actual explicit discussion with many of the people I work with is their patterns and their routines. So taking breaks. And I don't just mean tea break and lunchtime. I mean, if you're in the work environment, you'd be walking to this room for a meeting, you'd be walking there to the printer, you'd be movement in your day. In your home, when you've set up a corner of a room or you've dedicated a space, reminding people of the need to move in their day when you have arthritis is hugely important, and having mechanisms to remind you to do that. And that might be saying, I'll walk around the house at tea break. I'll use the bathroom upstairs to get some steps in. I'll use my phone to beep or buzz or a pop-up on my laptop to remind me to get up and move, because that's one thing that surprises people, that they're sitting for an awful lot more of their day, which has been funny. And then for people who haven't been working from home but are working differently, I suppose I work a lot with people in retail and healthcare and having to change some of their practices since COVID. And in some ways, COVID has helped us because of hand hygiene and latex gloves and managing all that increased awareness of space. It has made use of splints or use of different supports that people need much easier to navigate because they're under latex gloves. And that has made things a lot easier too. But that has been an issue for people getting back to work. I think we spoke about that early cocooning piece for this population when COVID came first of all. And yet this is a population who are well, but who live with a condition, and getting people back into work and into meaningful work has been very important. That maybe, yes, we need to look at how their day is to be COVID compliant, but that they do their job the best that they can do, that they're supported with. One thing I should have said when I was talking about working from home and I forgot is the connection with the team. Yes. That's something that has come up a lot. That opportunity for tea break and a chat, or working together over a space, that has been a loss for a lot of people, and that isolation in work is something that we really be encouraging people. You're working from home, but how do you connect back with the team? Email isn't the same as a conversation. We're possibly all a bit zoomed out at this stage, and it's our normal now, but it's not necessarily our comfortable normal. But naming that, again, it's that psychosocial support piece. So how do you stay feeling like you're part of work if you are working from home, and putting conscious time into having face-to-face or phone call meetings or virtual coffee breaks with your team or your manager, so that natural communication piece is there, because that connection is very important to help us to work well. And I think that's something that has been a challenge, or something that people know but didn't appreciate was as important until the thing went on as long as COVID has.
Exactly. There's some really interesting points there we're going to pick up on again in a moment. We're going to take a short break from our conversation with Yvonne to turn to our regular look at popular beliefs and understandings about arthritis. This week, Peter Boyd is exploring if you should exercise when you've got arthritis.
Thanks once again, Brian. Today in our regular slot examining common beliefs or attitudes towards arthritis, we're going to take a look at exercise and physical activity. a vital part of treatment and self-management. On diagnosis of arthritis, however, many people can decide to protect their joints by reducing the amount they participate in and cutting out certain hobbies. Given the pain, swelling and discomfort those of us living with arthritis can be in while living with a chronic condition, it can be understandable to be wary of causing more pain. But is there justification? Later I'll talk to clinical exercise specialist Andy Dunne about the recommendations for people with arthritis. But first, let's hear from Niamh Hogan and the people of Limerick on their attitudes to exercise and arthritis.
No, I don't think people with arthritis would exercise. Maybe swimming would be the easiest exercise for them to do. But other exercise, I don't think they do.
Every day, just going for a walk just to loosen yourself up. If you don't walk, you're seizing up, and it just takes a lot longer to if you miss 2 or 3 days walking, you're in agony and you don't do as long a walk.
Yes, I think people with arthritis can exercise. They're probably a lot more limited in what they can do, but I think it maybe if they go to ask their specialist or they go to a physio, I'm sure there are exercises and maybe even chair exercises if they're not even able to move their legs as much, but I think definitely exercise can only be good.
I have arthritis in both my knees and I like to walk, and I think it's very good for my arthritis. I find when I don't walk for a few days, my knees get very stiff and I find it difficult to walk. So all round I think exercise is really good for you.
People with arthritis can exercise, usually kind of light exercise, non-impact swimming pool type exercise and walking in a pool, those kind of things, even movement of arms when they're sitting down, small things, just continuously movement all the time.
So following on from those vox pops in Limerick, I'm joined by clinical exercise specialist Andy Dunne to discuss the beliefs and attitudes around exercise. Firstly, Andy, how crucial is exercise or physical activity to people living with arthritis?
I think it's vital. It's absolutely vital in terms of symptom management. So arthritis is obviously an inflammatory condition, and there are many types of conditions on the arthritic spectrum. But across the board, in the arthritic spectrum, exercise is relevant in different dosages for different conditions with different people. Where it is problematic is the belief that is out there that exercise can be harmful or damaging. The wrong exercise can be harmful or damaging. The right exercise at the right dosage can be life-changing for an arthritic person living with arthritis.
Yeah, and one thing that was mentioned there was I was talking about adapted exercise, light exercise, low impact, maybe walking in water. And how important is finding the most suitable exercise or physical activity for each individual?
Yeah, I think every single individual, we're all built differently, in terms of our limbs, the length of our limbs, the shape of our joints, how the joints move, our muscle tissue, our body fat, our age, our medical history. I think it's borderline irresponsible to prescribe one type of exercise across the board in any patient group. And certainly in the arthritic cohort, people who are living with arthritis will have some crossover and similarities in their symptoms, but like I referred to, their differences are unique. And as each person works through an exercise program, it will be very, very specific, or it requires specific instruction and detail and an allowance for the person who is stood in front of you trying to embark very bravely on an exercise program. So I think it's vital that the prescription for exercise is individualized.
And it is important to have that individualization. And then also we're looking at the kind of the WHO recommendations as the difference between physical activity and exercise. Could you give us briefly a bit of background on what the differences are between those two?
Sure. Yeah. Well, a physical activity is really movement, any type of movement. Exercise, moderate or vigorous exercise, is like a subset of movement. So general movement all throughout your day is excellent. It's entirely appropriate. Whether you've got aches or pains in the joint, general movement is not going to cause any serious issues around the joint. It certainly won't cause any further deterioration. While there might be differing levels of pain associated with movement, it is a safe thing to do. You're advised from the WHO to get approximately 150 to 300 minutes of that cumulatively in your week. Then the kind of moderate to vigorous exercise is about 60 to 75 minutes. In plain language, that's often described as, you're not able to have a comfortable conversation at that level. You're quite breathless. Where a lot of people living with arthritis, where a lot of people have difficulty with moderate to vigorous exercises, they assume it has to be done by weight-bearing exercise, by fast walking or jogging, and they feel that's not quite available to them based on their history. So moderate to vigorous exercise can be done in low-impact environments, in swimming, on cycling. It can be done with low-impact resistance and strength training. It can be done with walking where appropriate, but the ideal recommendation overall is that you get 150 to 300 minutes of that general activity and movement in your week, and you get 60 to 75 minutes in the higher heart rate zone. The challenge is, how do you get into that zone without causing discomfort to your joints or to your muscles, and you don't want to negatively affect your current medical presentation.
Well, we appreciate you giving us your insights, Andy, and thanks for joining us on Inflammation today. Now we return to Brian for more in conversation with Yvonne Codd.
Thanks a million, Peter, and welcome back to our conversation with Dr. Yvonne Codd. Yvonne, you were just talking there about the COVID context, if you like, and what I'm hearing actually is that the psychosocial aspects that you talk about, how people work, the community that work represents in terms of our colleagues, its importance in our daily lives represents so much more than, if you like, just the physical things we oftentimes think about, like ergonomics and appropriate keyboards or workstations. That it represents so much more. So that's a really holistic way of looking at all of this, isn't it?
Absolutely. And I think that's so important that you've picked up on that, because in research and in practice and with people that I meet on a day-to-day, they will come in and talk about the physical problems first. Pain, stiffness, lack of movement. That's the first problem with managing work. But actually, those problems can more often be remediated and addressed. Mm-hmm. But it's the wider psychosocial piece that has the biggest impact, and that people do really need support with to help them to self-manage day to day. And I know Arthritis Ireland are very informed and involved with self-management, and Kate Lorig and the Stanford programme, because that whole self-management piece has a huge impact on coping and continued engagement and continued confidence to continue engage in work. Mm-hmm. And sometimes it is about actively addressing anxiety and actively addressing the stress that goes with people expecting you to do, or the familial responsibilities that go with work. Sometimes it's recognizing that. It's just naming this is also part of the issue for me, and that recognition has a huge impact on how people adjust to work with arthritis and adjust to living with arthritis as a whole.
I'm wondering if we might kind of take, if you like, a case study approach or a particular context. So someone who's newly diagnosed with inflammatory arthritis, whether it's Angst-Bond or RA or PSA or any of them. And what advice you would offer someone who is just coming to terms with that? They're trying to figure out what it means for their life, for their relationships, but to bring it specifically to look at in the work context. What would be kind of practical, sensible things they can do that will help them in this situation?
Yeah, so again, I would be going back to the person first. So that person first, what are their physical impacts at this moment in time? What are the joints that are involved? What are the symptoms that are there? What are the limitations and things that need to be managed, and how are they managing them day to day through movement, joint protection and good ergonomics? Where are they at psychologically and psychosocially, and how are they adjusting and coping with this new diagnosis? What are their fears and their worries, and what are the supports that they have to manage that as well? And then because that has to be the starting point for everyone, because how you or I would experience the same thing is totally different. And but then taking it on a step from that is, what is the work? What is the job that you do? Where is the job that you do? What's the environment like? If you are hot desking, it's a very different scenario than if you have a dedicated workspace. So looking at all of those factors, what are the physical demands of the work that you need to be able to do, and how are they challenged because of the symptoms that you might have at the moment? What level of cognitive demands, multitasking, what systems do you use to work, or what systems do you work within that determine the way that work comes to you, the way that work is completed by you? And then what are your patterns around routines and breaks and managing within the work in that way? And then I would also move that on and back to outside of work. How long does it take you to get there? What your pattern of exercise is, what your sleep is like, what your diet is like, what you do for fun. And then within all of those, looking at what needs to change now, and then how can that change happen? And then also where can the change happen over time? So how can you get that person back to a level that as well as they can be? So trying to address the needs across all of that, either through equipment or splinting or advocacy, negotiation, making advice within the reasonable accommodations. We work very closely with the client as a first. And I think often people do better if they have the knowledge and skills and information to go to their line manager to discuss. And that's, I suppose, often my preferred approach, because I think the communication channels are best that way. But sometimes we would write reports, workability reports, make recommendations specifically, because that gives people a sense of armour sometimes to say, I have been advised to do this, I have been recommended to do this. And that starts the conversation in a way that can be more helpful for people to, depending on need and depending on want of each person. An OT will do a site visit to the workplace if that's warranted, and can meet with employers and line managers as well. So it depends on the person, because for one person, the OT in their workspace is the right approach for them. And another person would say, tell me what I need to know, tell me how to go about it, let me go and do it and come back to you and tell you how it went, and then take the next step. And I think that flexibility is very important, to recognise the difference that is humans, I suppose.
Is there much of a challenge, do you reckon, in terms of the variability of symptoms, the fact that these are invisible conditions for something like fibro, where oftentimes there's a lot of skepticism about, whether someone has it or not? It could take a long time to be diagnosed. So if you're an individual living with, a form of arthritis like that, or one of those related conditions, and you're going to your boss and, you're trying to explain to them how it's affecting you, but there sometimes can be, if you like, maybe a credibility gap, or they may not necessarily comprehend or believe that you're, how you're affected, or may not understand what it's like with chronic fatigue or chronic pain. Does that cause much of a challenge? And what advice might you give to employers in that situation?
It does cause a challenge, but I think an awful lot of that can often be the person thinking what their employer is going to think. And aren't
we all guilty of that a lot of the time?
Very much so. So the whole story has already been followed through in the person's head, and it never happened. So that's why, again, I would say, think about what you want to say, think about how you need to say it, seek help and advice around that, because oftentimes, I truthfully have to say, more than 20 years working, I haven't had a bad experience of engaging with an employer, and that is true.
That's really positive,
Yeah, I think there is a want to do well. I think oftentimes the employee has preconceived ideas and there is worry. So managing those, anticipating those, having the right advice to bring, either verbally practiced or booklets and guidance to give that. And also employers typically want to know, and what can I do, or what do I need to do? So I think coming to say, this is what it is, this is what I can do. And I suppose that's something I would be very passionate about. People with chronic conditions can do, are work able, and the focus needs to be on ability and on capacity and not focusing on what you can't do. So there's and I don't mean don't disregard the challenges, but you also need to come with I want to be here. If you want to be here, I want to be part of this workforce. These are the things I can do. These are the difficulties, and here's some reasons and ways that we can navigate some of those. I think that links back with disclosure too. I would have met many people who would, when I've said, have you disclosed your diagnosis to your employer? And they'd say, oh no, but it's totally obvious. They'd know to look at me. It's obvious, everybody knows. But I think that's a responsibility of an employee. Your employer can only work with the information they have been told by you, even if it's totally obvious. And I think that you need to consider that and make a decision around properly disclosing a diagnosis so that you are under that umbrella of legislation and you can access supports, because sometimes people are frustrated, they don't do this, and but they actually never told them properly. Yes. Yeah. So that responsibility is a two-way piece. The employer needs to respond to a disclosure, but to access supports properly, the client or the employee needs to tell them and needs to tell them in a way that comes with clarity, I suppose, as well. So that's something just to think about.
Yeah, it's kind of interesting there. There's a theme almost emerging in what you're saying regarding things that are outside of someone's control that can't be changed. But in many cases, actually, there's an awful lot that's within the individual's grasp. Decisions that they can make, conversations that they can have, choices they can make for themselves, and recognizing that. And I'm wondering then in that context, where someone is in a situation where it's not possible for them to continue on in a particular role any longer. So the situation they're facing is retraining or moving to a new position. And sometimes that can be kind of a challenge. That can be a lot of fears around all of that. Are there good ways of doing it, or what would you advise someone who is in that position and recognizes, okay, I'm looking here midlife and I've got to change a career is what my way forward?
I would quote my old maths teacher here, and I'd say, Festina lente, make haste slowly. That's what she used to say about every maths problem to give us to figure out. And I would say the same for this. Take your time. Think about where you're at right now. What are your commitments? What are your responsibilities? What are your likes and interests and your skills? Where is your arthritis at now, and how stable is it, and what are your concerns about it? Because they're very important factors to be recognizing and thinking about when you're looking to make decisions. Sometimes it's a real option for people to change role within their current company, and they don't always give that thought, or they jump a little bit far ahead in that decision. So that's something to think about. Sometimes it's a change of field or to something totally different. And there are some brilliant options there available. I'm sure you know about springboard.ie, which is the Higher Education Authority company, and they run free and subsidised courses for people, and they're all accessible for everybody. Phenomenal initiative. And so that's for undergrad or postgrad if you're looking to do some retraining. The county partnerships do some great work in terms of support with CVs and prepping for interviews too, and as do the libraries and the local education training board. So there are lots of services to access when you're thinking about it. And I suppose making haste slowly, thinking about where you want to go, thinking about the cost that may come with retraining and how that would counterbalance, thinking about the time, and then trying to make decisions that suit where you're at from a health point of view, but also stage of life, other commitments point of view too. So yeah, I suppose they're the kinds of things I would be saying to you to think about, thinking about what the commute with a new job would be, what the flexibility within a new job would be, and if you're looking to different companies, how the match is how well they're going to match up together for you, for your wants and dreams within your employment career, and how well that maps onto where you are from a health point of view as well.
It's great that you're signposting there to those resources, because it strikes me, if someone has been in a role for a long time or possibly hasn't done an interview in years, that might be quite daunting. Trying to figure out how am I going to put a CV together, and I don't know how to do an interview. But it's back to the thing again, really, isn't it, of having conversations, asking for help, seeing what supports are out there, and then kind of moving forward, in a measured way.
Absolutely. And people don't realise some of the supports that are available there. So it is that thing of asking, looking, exploring, thinking, getting your case together, getting your pages together, starting that first draft, having a look, having a think, how does it feel? And I suppose not being bounced into decisions. They really do tend to have the worst outcomes when people bounce and make quick decisions. So yeah, take your time, think about it, ask questions and look for help, because the help is there.
Maybe it's opportune, actually. I mean, obviously you yourself are an occupational therapist. Just maybe to explain to people what the work of an occupational therapist is and what type of support you offer and your colleagues offer to people.
Yeah, so as an occupational therapist working in the public system, if I would see any client who attends a public rheumatology consultant. So if you attend a public rheumatology consultant, you can access occupational therapy. And occupational therapy is looking at the symptoms that you are dealing with as part of your condition and looking at how to manage those symptoms. But most importantly, looking at how those symptoms are impacting on your day-to-day life and your roles and responsibilities. So when I'm meeting somebody for the first time, I'm very interested to know where they're at in this moment in terms of symptoms, but also where they're at in this moment in terms of home life, driving, work, leisure, parenting, social roles, and then trying to look at where the needs and wants are within that to manage symptoms better, so that those roles are sustained in a way that's satisfying for the person and they're not overwhelmed or losing roles because they are so caught in trying to manage symptoms on a day-to-day.
Yvonne, finally, I'm wondering, are there proactive or, if you like, preventative measures we can take to ensure that the workplace is a positive setting for musculoskeletal health? A lot of what I've been talking about really has been responding to people living with chronic disease and arthritis. So how can we get ahead of all of that?
I think the culture around work is changing. Healthy Ireland framework has said that they want the Irish workforce to be healthy and well so that they can continue to stay in work. And that has come on foot of work by the EU Study Observatory, which is recognising that people are living longer, working longer, and birth rates are declining. So there is a growing awareness that we need people to stay in work from an economic point of view. So I think that is actually springboarding the conversation into awareness of difference over the lifetime of workers. And I think that's a very healthy thing. I think there have been a lot of changes and improvements in terms of workspace and environmental setup within work, and kind of knowing the risk of repetitive strain and musculoskeletal injury from poor work practices. But I think the wider psychosocial piece also does need to continue to have that conversation to challenge, I suppose, in a way, some of the misconceptions. And in doing so, we're going to continue to move it forward. And I think that's hugely important. I did want to just add in one thing, Brian, about, I mentioned about if you attend a public rheumatology consultant, you can ask for a referral for occupational therapy. If you don't attend a public rheumatology service, I think it's just worth knowing a couple of things, that you can seek to find out a list of private practitioners through the Association of Occupational Therapists of Ireland's website. I think that's an option for someone who's looking for help, bearing in mind the employee retention grant for private businesses can fund assessment and any interventions that people might need in their workforce. So if you're not under a public consultant, that's another way.
Really good to know.
And the other thing, just to let you know about at the moment, or to let people know about, is that Trinity College Dublin, under the discipline of OT, are conducting a work and arthritis study at the moment. And you can look up work and arthritis on Twitter. But that they're recruiting, so that they're comparing two types of work-based interventions. So that could be a way that may appeal to people to get access to work supports if they can't do so through other means. So I just thought it was good to let people know about that as well.
Absolutely, yeah. That's a fantastic piece of research, actually. It'll be looking forward to hearing the outcomes from it, for sure. Yvonne, listen, thank you so much. It's been a real pleasure having you here. And that's all from this episode of Inflammation Nation. Don't forget to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. For further information about arthritis, you can visit our website, arthrititsireland.ie, or contact the helpline on 0818 252 846. See you next time. Inflammation Nation is supported by Pfizer.